Recovering from an eating disorder is a journey marked by courage, resilience, and hope. It is not a straightforward path, but rather a process of rediscovering trust in oneself, rebuilding a healthy relationship with food, and learning to care for your mind and body with compassion. If you or someone you care about is struggling with an eating disorder, whether it's anorexia, bulimia, binge eating disorder, ARFID, or another form, it's important to remember that full recovery is possible. It often requires professional support, practical strategies, and a strong network of encouragement. Here's a comprehensive guide to understanding and navigating the path to recovery. Begin by understanding the true nature of eating disorders. These are not simply bad habits or choices that can be changed with sheer willpower. They are serious mental health conditions influenced by a web of genetic, psychological, and environmental factors. Anyone can be affected, regardless of age, gender, body size, or background. Eating disorders are often misunderstood, but it's crucial to recognize that they are not a reflection of weakness or a lack of discipline. They are illnesses that deserve empathy, respect, and evidence-based treatment. Early intervention can make a significant difference. The sooner treatment begins, the better the chances of recovery, and the lower the risk of long-term physical or psychological consequences. If you suspect you have an eating disorder, or if you're supporting someone who does, reaching out for help as soon as possible can be a life-changing step. One of the most important foundations for recovery is building a strong support network. Seeking the guidance of a therapist or counselor who specializes in eating disorders is critical. Therapies such as cognitive behavioral therapy enhanced, CBTE, dialectical behavioral therapy, DBT, acceptance and commitment therapy, ACT, or family-based treatment have been shown to be effective. A registered dietitian with experience in eating disorder recovery can help develop a plan that prioritizes health and nourishment over weight or appearance. In addition, friends and family who commit to being supportive by listening without judgment, respecting boundaries, and refraining from comments about food or bodies can be invaluable allies. Peer support groups, both in person and online, offer a sense of community and understanding that can help reduce feelings of isolation. Focus on nourishment, not numbers. During recovery, it's common to feel anxious about food, weight, and body changes. One practical step is to avoid weighing yourself unless it's medically necessary. Fixating on the scale often hinders progress. Instead, shift your attention to nourishing your body consistently. This means gradually reintroducing regular meals, aiming for 3 balanced meals and 2 to 3 snacks each day. Every meal should include carbohydrates, proteins, and fats, as each macronutrient plays a vital role in physical and mental health. There are no inherently good or bad foods. Learning to honor your hunger and give yourself permission to eat a variety of foods, including those you may have labeled as off-limits, is a powerful act of self-care. Do this slowly and, if possible, with the support of a professional or trusted person. Challenging distorted thoughts is another cornerstone of recovery. Eating disorders often involve rigid beliefs about food, body image, and self-worth. Keeping a journal of triggering thoughts can help you become more aware of patterns and begin to question their accuracy. Replace negative self-talk with more balanced, compassionate perspectives. For example, instead of "I messed up by eating dessert," try "Allowing myself to enjoy food is part of healing." Practice body neutrality. Shift your focus from how your body looks to what it enables you to do, like walking, laughing, or creating. Limiting exposure to triggering media, such as social accounts that promote diet culture or transformation photos, can protect your mental space as you work toward recovery. Self-compassion and emotional regulation are essential tools. Recovery is not about perfection, it's about progress. Learning grounding exercises can help you cope with difficult urges or emotions. The 5-4-3-2-1 technique, for example, involves noticing 5 things you can see, 4 you can touch, 3 you can hear, 2 you can smell, and 1 you can taste. Deep breathing and progressive muscle relaxation are other effective strategies to regain control during stressful moments. Recognize that slips or setbacks are a normal part of the process. Instead of judging yourself harshly, acknowledge these moments as opportunities to learn and recommit to your goals. If you are cleared by your doctor, engage in gentle movement, such as stretching, yoga, or walking, not as a way to burn off calories, but as a way to connect with your body and support your well-being. There are many resources available to help along the way. If you're in crisis or need immediate support, helplines such as the National Eating Disorders Association, NEDA in the United States, the ANED Peer Support Network, Beat Eating Disorders in the UK, or the Butterfly Foundation in Australia offer confidential assistance and guidance. Peer support groups, both local and online, can provide a sense of belonging and understanding. Books such as Intuitive Eating by Evelyn Tribole and Elise Resch, Sick Enough by Jennifer L. Gaudiani, and Life Without Ed by Jenny Schaefer can offer education, hope, and practical tools for navigating recovery. Online platforms like NEDA and Recovery Warriors feature articles, podcasts, and recovery stories that can inspire and inform. The steps to overcome an eating disorder begin with self-awareness. Acknowledge that there is a problem. This is not a sign of weakness, but a courageous act of honesty. Seek professional guidance early. Don't wait for symptoms to worsen. Breaking the secrecy is vital. Share your struggle with someone you trust, whether it's a family member, friend, or counselor. This can relieve some of the burden and open the door to further support. Work with a registered dietitian to create a structured meal plan that meets your nutritional needs and supports your recovery goals. This plan should not be about restriction or weight loss, but rather about healing your relationship with food and ensuring your body gets what it needs. At the same time, invest in developing emotional coping skills. Many people with eating disorders have used food as a way to manage stress, anxiety, or difficult emotions. Finding alternative outlets, such as journaling, art, music, meditation, or talking with a friend, can help you process emotions in healthier ways. Celebrate small wins along the way. Recovery is made up of countless little victories: eating a meal without restriction, trying a new food, expressing your feelings instead of bottling them up, or reaching out for support when you need it. Each of these moments is progress, no matter how small it may feel. Be patient with yourself. Recovery is rarely linear. There may be periods of rapid improvement and times when old patterns resurface. Setbacks are not failures. They are opportunities to learn and grow stronger. Above all, remember that you are not alone. Millions of people have walked this path and found healing. With the right support, practical tools, and a commitment to self-compassion, recovery is not only possible, it is within reach. Every step you take, no matter how small, brings you closer to a life of freedom, balance, and self-acceptance. If you are struggling, reach out. There is help, there is hope, and there is a future beyond the eating disorder.